Hello and welcome to An Ink We Trust, Tattoo in Our Culture in San Fernando Valley, the latest from Who's Making a Mark in the Valley tattoo scene. I'm your host, Anthony Sanchez. Today we're going to be talking to Dr. Sean Aldridge from the Tattoo Removers in Sherman Oaks. Thank you for coming by the studio.
It's my pleasure. Thanks for inviting me.
Thanks. Well, so why don't I kind of maybe start off with, how's your morning been so far?
Great.
Yeah.
Really enjoying the morning so far because I'm off.
It's your day off.
I was able to sleep in.
Any hobbies that you pursue in your?
No, as a small business owner, your only hobby is to do the business 24/7. So this is part of that.
Okay. Well, thanks again for coming through. Have you seen any good movies or TV shows recently?
Yes, yesterday I did a little bit of a binge watching of The Crown.
Okay.
On Netflix, which I loved, and also I did what was that? I can't remember now. But at any rate, I love streaming media.
Okay. Yeah, I think we talked about for the show that I also did a little binge watching in The Crown season 3. It's pretty good stuff. Well, let's jump into you being a tattoo removal. Do you have a tattoo?
I do not.
You do not?
I don't. I'm asked that question all the time. They want to know when I do the laser tattoo removal, well, how does it feel? I said, well, I don't know. You have to tell me.
So you work with lasers. Have you ever zapped yourself just to see what it's like?
The thing is, with my laser for removing the ink, you won't feel it if it's not ink or not pigment. But ink, you feel the most. But if it's just the bare skin, you won't feel the zap from the laser.
Okay. So tell us a little bit about your practice. What you do? What's your specialty here?
Well, I am in Sherman Oaks, as you stated, and I've actually been in Sherman Oaks for 13, almost 14 years. But in 2015, I became aware of the new technology for removing tattoos or removing ink by laser. And so I invested in a Cutera Enlighten, which is a laser that has probably the most advanced technology these days to begin to do this business of removing tattoos. And also we do benign pigment removal, like freckles, so on and so forth, sunspots. We also do hair removal. Now that's a separate laser machine, but I have an aesthetic, what is called an aesthetic practice in dealing with skin care, appearance, approval. We also do some body contouring, so on and so forth.
Do you feel like LA's good business for this kind of stuff?
Oh yeah, definitely. Definitely. LA is very good for it, and we have a very good location being right at the 405 and the 101 because we get people from the north, we get people coming up from Orange County, we get people coming from San Bernardino and Riverside, people from Ventura, so we get all all these communities funneling into our little location.
That's good to hear because, Riverside's furthest I've been sometimes is like Moreno Valley, and one time I was like, what am I doing here? There's no lights. No, in Moreno Valley, there's actually some really cool spots, but it was like...
I know, and then there may not be any services like mine in most of the areas.
Yeah, I guess so, right?
So we get people from all over.
Obviously, they take a look at your stuff, and they're like, it's worth... taking care of that. How did you fall into this? Did you kind of, obviously you didn't wake up one day and go tattoo removal?
No, I'm a primary care doctor by training, internal medicine specialist, and I have been doing that for over 40 years.
Wow.
And I decided that it was time to do something else, something different. And so a representative from the company that manufactures my machine just happened by. He was going through my medical building and stopping at different offices and saying, we have this new technology, would you be interested? And I was, because I had in mind I'd like to branch out into something different. And so that's really it in a nutshell.
I guess I should ask the stock question with, like, how proud is your family that you're a doctor? It's like every family wants that doctor, that doctor, that lawyer, right?
Yes, they're very proud. My parents, who are both deceased now, they were very proud of that fact. But and I'm proud too. It was a lot of hard work, and still is a lot of hard work.
For sure.
But I'm thankful and grateful for those along the way who assisted me and who helped me, in that endeavor. Good teachers, family support, and good patients.
Yeah.
So one thing that I really enjoy about the laser tattoo or aesthetic practice is the fact we have some very interesting patients who are coming, and I'm always appreciative that they would choose me to come and have their services performed, because they have many options these days, especially in LA, for these kinds of services. So I'm grateful to have them come and be my patient.
Do you think also, just because we have a lot of younger students listening, how important it is to kind of find a specialization eventually in your career?
Well, I think it's important to do that, but I think more important is making sure that you've done your homework regarding the career you're choosing. I wouldn't choose a career just because it's something you enjoy. I wouldn't choose a career just because it makes a lot of money, so on and so forth. Look at all those aspects and look at what you project for the future. Now, some people have what do I want to be doing 5 years rule. I'd look beyond that, because you need to look toward retirement as well, and you need to be able to do something you enjoy, that you're going to be doing a long time, but at the same time, something that can take care of you financially today as well as in the future. So all those things are very important. In my time, I graduated from medical school 40 years ago. It was all about the practice, as far as the practice of medicine. There was no education about how to run a practice or the business aspects of a practice, which has become more and more important over the years. So do your homework, look at the ins and outs about anything you want to get into, and if you're able to specialize in a particular area and get a niche, you are setting yourself apart, and you should be successful.
Great. Well, let's get back into your tattoo removal. You just mentioned about your patients, how great your patients are.
Mm-hmm.
So what are some of the things that you've heard from your patients about why they're coming to you to do a tattoo removal?
Well, if it weren't for ex-boyfriends and ex-wives and so on and so forth, I probably wouldn't have a practice.
Again, LA is a good place for that industry. I've always had said something cynical where it was like, if I was going to be a lawyer, I'd be a divorce lawyer. And like one of my managers that I worked for at the time, she was like, "That's horrible." I was like, "But it's kind of like it happens."
It happens, definitely. So I get a lot of name tattoos that I'm removing.
Mm-hmm.
One area that I'm developing as well is fading tattoos, not necessarily removing them. But in the culture that we have today, most of the later generations that we're living with are having some kind of tattoos done. And they may not regret those tattoos now, they may regret them in the future, or they may want the tattoos completely removed. Like if it's an ex-boyfriend's or ex-wife's name, they may want that completely removed. But they may have a work of art, really, on their body that they don't want to remove, that means it has some special meaning for them. They may just want it modified a little bit or fade it to cover it up with other kinds of ink. So I'm doing a lot of fading for people who have tattoos. They don't necessarily want them completely removed, but we can help them fade the tattoo or modify it in such a way that they can have the tattoo that they want.
Yeah, and I think that that's a good thing to bring up, that because I've heard this in the other shops as well, like we talked about before, where you might think, oh, I can get a cover up of this, but because some of the inks, your skin, you gotta bring it down. They're like, you got to go to laser removal, so you would be the guy that they need to go to
Exactly.
first before they can do something on top of that.
Exactly, and it's not an overnight process. Fading or removing it. I get a lot of new consultations in every day, and potential patients don't understand many times that it's not 1, 2, 3 and it's done. It is an investment in time and finance to do the work that needs to be done. One reason is the fact that your body's immune system removes the ink. The laser doesn't remove the ink. You could have a laser treatment almost every day and not really see much of a difference, because the laser on a microscopic level breaks down the ink. That's all its function is. It's your body's job to remove that ink, and your body's skin and immune system needs time to do that.
Right.
So we're looking at usually at least 6 to 8 weeks as a good
Between sessions.
Yeah. Treatment time. So even if you just got 6 sessions, 6 to 8 weeks apart, you're looking at close to a year's time. So it's important for patients to understand that they don't come in, we zap them, and then it's gone.
I imagine that's a challenge for people that think it's just going to be a one-time thing, or just to because a year's a long time to kind of go through that process.
Yes.
Right?
I mean, there are variables, and there are a lot of factors that go into tattoo removal. The ink itself, the color of the ink, the age of the ink.
The age.
The older the ink, the more brittle and fragile it is, so the easier it is to break up and remove. If it's very young, usually that can be problematic in that it will take a long time to remove. But that's my experience.
Yeah.
There are others who might debate that and who will tell you, well, you just had this done a few weeks ago. Come in now, and we'll rid you of it more quickly because it's so new. But that's not been my experience.
Yeah.
My experience is that the younger the ink, the more gooey it is,
right,
and harder to separate and pull apart. I know that in some instances that can happen where, depending upon the person's skin, where they get a recent tattoo and they were able to kind of remove it with a lot of concentrated laser treatments. But I'm always concerned as a physician, I'm always concerned about hypopigmentation in a darker skinned patient or a patient with pigment. And in any patient, I'm concerned about scar tissue formation. And if you try to rush the body's natural processes, you can engender the formation of scar tissue. So as a physician, that's something that I'm very mindful of and will advise the patient. I think you really want to spend 6 to 8 weeks. I can treat you every 4 weeks if you insist, but I want you to understand you might have scar tissue at the end of it. So
you're seeing some patients that just got a tattoo 2 weeks. So is that really?
Some patients just got it that day, and they come in and they said, I don't like this.
Whoa.
I want to get rid of it. And I said, you're still healing.
Yeah.
And once you're well healed,
yeah,
that may be a week, maybe 2 weeks, it may be a couple of months, depending upon the person and the tattoo. Once it's well healed, then we can talk about removing it.
Yeah.
But no, some patients have tattoo regret right off the bat. And a lot of patients that I have tell me, well, right when I first got it on, I didn't like it. And so they've been thinking about it. It's been marinating in their mind. I'm going to get this removed, eventually. And so sometimes they just come to a point where they're fed up with it and they take the plunge in getting it removed. But a lot of patients know right away that they don't like a tattoo and they want to remove it.
You probably also, I do have actually, as I remember, a friend that as she was trying to get more professional, she was trying to hide visible tattoos too, right?
Yes, we get a lot of those patients who, for that reason, they are seeking to start or get into certain professions. And we have a lot of patients who come because they want to get into the police academy, or they want to get into the military, and they have facial tattoos, or they have hand tattoos, or neck tattoos, and they can't be having those so visible to get into those services. So we get those patients as well.
I mean, this is also why I wanted to have you on the show, because it's like, I also feel like a lot of people who get tattoos are spontaneous, so it'd be hard to give them a cautionary tale, but I think it is important for people to know as well on the other side of it that, it will take something that takes an hour could take a year to take off your skin.
Exactly. And something that may have taken $100 could take $1,000 to remove. So it is an area that if you're going to get a tattoo, think about it. And make sure it's something that you want to keep forever, because they're meant to be permanent, most of them. Now, not every tattoo that I see or treat has been done with permanent ink. Some has been done in a garage with amateur ink. Some are what we call stick and pokes.
Yeah, like a prison tattoo. Exactly. Or something. Yeah.
Some are, some parents bring their kids in because in school they've done like pencil lead or something where they've, tattooed something on their arms. So we get all kinds.
Now I want a reality show of this. I need to see this every day. So why are lasers preferred? Because I saw in my research that sometimes you could do surgical, you could do dermabrasion, you could do CO2. Tell me why you think lasers are the best option.
Well, CO2 may be a type of laser.
Okay.
There are gas lasers, CO2, argon, so on and so forth. But the laser that I use, that is the most commonly done with either using picosecond or nanosecond technology or Q-switch technology, they're probably preferred because the other modalities may cause scar tissue and not give them the best outcome. I've seen a number of patients who've come to me after they've had dermabrasion, or they've had this or that, and they had scar tissue and they didn't either didn't get rid of the ink or weren't satisfied with the scar tissue that formed. So with my laser, it's one of the later models for tattoo removal, whereas years ago, the lasers that were used could cause a lot of tissue damage surrounding the ink, but the later technologies can get deep into the dermis or the skin, break up the ink without causing a lot of peripheral damage of the skin. So I would say dermabrasion and some of the other modalities may work for some people. I'm not saying anything against those modalities, but I've seen a lot of patients who've tried to use that or use chemicals they got off the internet or this and that.
I have that on my my list here. What are your thoughts on home remedies there? I saw a thing about lemon juice, a thing about bleach, a thing about hydrogen peroxide, a thing about salt. After a while, I was like, I'm not going to keep writing these down. I know he's going to say no.
Yes, I would say no, because I've seen the results of many of those, and I don't profess to know all about those modalities of treatment. All I would say is that I've seen patients come in who've had bad results, and so they come in to finish their treatment with me and with the laser. So I don't really, I don't have a good feeling for a lot of those modalities that you've mentioned, and I have to admit I don't know a lot about them, so I won't judge or I won't bash, any of those providers who do those things. They may be experts in their own field, but I see a lot of patients who come in having tried those and they didn't work for them.
So why don't we talk a little bit about, so since you have professional experience with this, I always get kind of the cliff notes from the tattoo artists about how the tattoo gets in there, and then a little bit of how the laser kind of takes it out, right? Like it's on the kind of the surface layer. It's not in your skin.
Well, no, it is in your skin.
Okay.
It's deeper than the surface.
Okay.
The surface, which is called the epidermis, but it's deep. The ink layer goes deeper into your skin. Your skin is made of a number of layers. The topmost layer is what we call the epidermis, and it's basically made of dead cells that are flaking off. But you go deeper into the skin, and that's where the ink that is deposited. And I'm not a tattoo artist. I don't know all the technology that they use or what they use. I know needles and so on and so forth, but all I know is that it will take a laser, most likely, to be the best treatment to break the ink up so that your body can remove the ink naturally. So I don't know if that answers your question.
And that's the transition there is, so the laser, what's the technology of the laser doing then?
Well, the laser is, any laser, of course, is a focused light beam. And our laser does what is called automechanical automechanical blasting of the ink. The ink usually is deposited on a microscopic level in globules or globs, I should say, of ink. And a laser comes in and begins to blast away at that glob of ink. As I said, the older the ink, the more brittle it is, the easier it is to break down. But we use different wavelengths of the laser to attack the ink, break it down, and continue that, aiding the process of your body naturally removing the ink. Now, your body, from day one, your immune system has considered the ink to be a foreign material. So anything foreign in the body, the immune system's job is to remove.
Okay.
So your body's immune system has already begun to attack the ink that you have.
Is that what's happening to my healing tattoo right now? Is that why it hurts?
No, that's just inflammation.
Okay.
But over time, all tattoos are going to fade. They're not going to be as brilliant as they were when you first got them. And that process of fading has been conducted by your own immune system to remove the ink little by little. All the laser does is geometrically speeds up that process.
And when it breaks it up, what happens to it? Because I'm sure people will be like, oh, a lot of health freaks would be like, what?
Yes. Well, the body removes it as it would any foreign body, like a virus or bacteria. It's the white blood cells, which are a great part of your immune system, gobbles up like a Pac-Man would gobble up, little pieces of ink and removes it through what is called the lymphatic system. The lymphatic system is comprised of channels and lymph nodes. Give you an example, if you have a throat infection, the lymph nodes underneath your jaw or here will swell up. They may become sore or they may become enlarged, and you'll feel that. That's your lymphatic system, part of your immune system, that's gobbling up and removing and interacting with that bacteria that's causing your sore throat. To get rid of it. And so it throws it out in your lymphatic system. It doesn't go into your bloodstream. That would be toxic.
Okay.
You don't want bacteria, viruses, or ink in your bloodstream. You don't want it going through your kidneys. That would be toxic. So it throws it out in your the way that your immune system works and functions, gets rid of it. So to answer your question.
So aftercare, what do you recommend when you get to that part?
Usually, immediately after we treat, we advise using a gel like Vaseline or Aquaphor. Now, Aquaphor and Vaseline are both petroleum-based, but some people use other non-petroleum-based salves and ointments. But we usually recommend either Vaseline or Aquaphor. Just as when you got your tattoo, perhaps your artist advised you to use Vaseline or Aquaphor on the area. You keep it moisturized for a few days. You keep it covered with a non-stick dressing. That is, when you change the dressing, it's not pulling away the treated area or pulling the skin away. You cover it there. Sometimes after treatment, you'll have inflammation severe enough to cause blistering. And that's not necessarily a bad thing, except if the blisters become infected. So you want to keep them protected until they collapse on their own and go away.
What is medically the reason why you suggest the Vaseline? Does it protect the bacteria? You said it keeps it from getting dry. Is that mostly what you're looking out for?
Well, yeah, you're Doing that, you're keeping the area moisturized while the acute healing is going on. The time between treatments is not for healing, and a lot of people don't understand that. If we have them come back in 6 weeks or 8 weeks, a lot of times I'll get a call from a patient after I've explained all this to them. In 2 or 3 weeks.
Now you can just show them this show. You're like.
After 2 or 3 weeks, they'll call and say, "I'm healed. It's time for another treatment." I said, "Well, I'm glad that you're healed, but the time that I set wasn't for healing. I know you might heal in a few weeks. You might heal in a few days, but your body needs the time to do its job to fade the ink."
Oh, I see.
And after the ink, after your body does that, then I have you come back so I can see how much fading has taken place. That gives me a guide where to go next.
Right.
If you come back in a day, you haven't done any fading. And if I were going to treat you the next day, it would be the same treatment that I gave you the day before, which would not be good. What I want to do is make sure you have the correct treatment by allowing your body to fade it. I need to see how well you fade, and I need to see what the body is going to do to fade it. And then I'll have a little guide in my mind where to go next with your treatment.
Maybe I'll ask what colors do you think, you kind of mentioned a little bit, easier or harder to remove?
Very good question. In my experience, black is the easiest to remove. For some reason, the laser interacts very strongly with black ink. The colors are harder to remove. In my experience, green and blue are the hardest that I find. And midway between maybe red and yellow and orange. But when a person comes in for a consultation and they show me a tattoo, usually their colors and black ink, I usually tell them, well, the black ink is going to be the first to go. We'll treat we'll treat all of the tattoo. We're treating the colors as well, but the colors aren't going to respond as quickly as the black ink will. So if your tattoo is all black, you have an easier course of tattoo removal than if there were a lot of colors mixed in. Now, for some people who are coming just to have a fade done, the colors may not be an issue for them, especially if they're really light colors, because if they're planning to get a cover-up using black ink or darker ink, then they're fine with that. But if they want a cover-up that involves a color or light ink over where there was black ink, then they're going to need time to remove that black ink out of the way before they can get a color, because otherwise it's going to show through. So colors are difficult. They take a long time. They are doable, definitely. And I've seen good fading of colors. It just takes time. So I have to explain to the patient, please be patient with this process because it's going to take time to get rid of those colors. Black ink is going to go more quickly, but even black ink is going to take time to remove as well.
And we'll have links to like your before and after pictures, because I've seen some of the stuff that you've started that kind of, over time.
Great.
And does the time, because you said like 6 months to 9 months, is it also because of the size, like, whether you have like a little heart on your wrist versus you have a chest piece?
No, size doesn't matter. Again, it's age of the ink and the ink itself, the colors, your immune system. Everyone's different. Everyone's immune system is different. Your immune system may be more robust than your neighbor's, and so your tattoo may fade more quickly. It's always interesting to me when a patient tells me, well, my friend had an equal tattoo, so on and so forth, and theirs was done in 6 months. But I'm saying, well, that may not be your case. You're a different person. You have a different immune system. And if you had a different artist and used different ink, all those are going to factor into how quickly and how well your ink is going to fade or be completely removed. So the size necessarily of the tattoo doesn't play that much, in my experience, a part in what you can expect. In that, the more ink you have, the longer it's going to take for the provider to treat that ink. If it's just 3 dots, as I see a lot of, on a hand or by the eye, then that still may take 6 months to get rid of, but it's easier to treat because they're so small.
Even if it's the little dots, you would have to treat like 2 or 3 times?
Mm-hmm.
Wow.
At least.
Wow.
Depending, but a lot of times with the little dots, they weren't done by a professional tattoo artist. They were done by an amateur. And so
polite.
Amateur ink is easier to remove than professional ink. Professional ink is usually meant to be permanent.
So let's see. Well, tell me a little. On your website, you have comfort apps. What is that about?
Well, that's my term for the measures we use to provide the patient with as much comfort during the process as possible. Ink removal is a painful process, and for most, in my experience, it's more painful than actually getting the tattoo itself.
I'm glad you said that because I didn't want to bring it up. I was like, I don't want to ruin his business, and tell me how much it hurts.
Yeah, but we have modalities to help you with discomfort. And truly, as the ink begins to fade and fades more, it's less and less painful.
Oh, okay.
Mm-hmm. So right at the beginning, if it's a very new tattoo that's never been touched, that's probably going to be the most painful treatment that you experience. Even though in the protocol for removing it, we use stronger and stronger power behind the laser. It's going to be even higher energy, and you would think that would be more and more painful. But as the ink really begins to truly fade, it's actually less painful. We use topical agents such as lidocaine cream or anesthetic cream. That's the most common form to relieve the patient's discomfort. And many patients who've had hair removal or other kinds of laser procedures are acquainted with topical cream, lidocaine cream. And you can even get it over the counter or off the internet at a percentage that is low. I use prescription strength, so it's not something that you can buy. You can't necessarily get mine off the internet because it's a stronger one. But you have that. We have injectable lidocaine.
Oh, all right.
And for me, I use it for smaller tattoos because it's quick, it's easy, and it's more effective than the cream. Also, in my arsenal of pain abatement, I use nitrous oxide, which many people refer to as laughing gas.
Yeah.
They may have gotten it in their dentist office.
Yeah.
But ours does not put you asleep. You're able to drive afterwards. But a lot of patients won't get treated without that. Nitrous oxide in combination with some of the others because it does such a good job of helping them with their pain.
Even before they go, then do you recommend like they don't drink the night before, or they don't have a lot of Tylenol or something like that?
Well, no. The only thing that we prefer that a patient not do before they have a treatment is to be out in the sun.
True.
And either in the sun directly or in a tanning bed or a tanning lotion. We don't want them to use that before they come in for a treatment. We also want them to, especially if they've had a treatment, we give them paperwork saying try to avoid anti-inflammatory medicines that can interfere with healing and especially with bleeding and clotting if there is any tendency to break a little blood vessel or something. So no Advil, no Motrin, no ibuprofen, strictly Tylenol, which is not an anti-inflammatory. So those kind of issues. But drinking per se is not necessarily a contraindication to have a treatment done.
And tell us, you also do the hair removal. So
we do laser hair removal.
So that's going to be a whole other thing to talk about. What do you approach with that?
Well, we use a different laser for hair removal, and it's just a matter of destroying the hair follicles. Our tattoo removal laser does not destroy hair follicles, so we can treat a patient even over their hairs you know.
Yeah, I think I saw that in some of your one guy had like his leg, and he still had his
Right.
leg hair intact.
Right.
I was like, so you don't have to shave it.
Right, and a lot of ladies come in to have their eyebrows done once they've had them inked or microbladed.
The permanent one, right?
Yeah.
Yeah.
And so a lot of times they're dissatisfied with the results, so they come in to have us remove the ink that was done, so they can start over. But our laser for that does not destroy the hair follicles, whereas we have a separate laser that will destroy the hair follicles. And depending upon the area, you come in and you get anywhere from 6 to 8 treatments. And sometimes it's 4 weeks between, sometimes it's 6 weeks, sometimes it's 8 weeks, sometimes it's 10 weeks, 12 weeks between treatments, because your hair grows at different growth rates. It's not all uniform. Say, for instance, a patch on your arm, all the hair follicles, some hair follicles are going to be growing new hair, where other hair follicles, the hair is old and is ready to fall out and to grow some more. So different follicles, even within the same patch, are going to have different rates of growth. And so you need to have a number of treatments to try to catch each hair follicle at the optimum time to destroy it. So if that gives you an idea of what that's all about.
And you probably get the common, like the bikini areas.
Mm-hmm.
What are some other areas that maybe people don't think about for hair removal?
Well, to be honest, I have all kinds of patients who need hair removal. We have quote unquote bearded ladies who have a lot of hair, like in a beard distribution, like on their face or under their chin, and they need that removed, because whereas they may have been plucking it or tweezing it out, that's not the ideal way to get rid of it. So
plucking doesn't kill it eventually. Sorry to cut you off.
No, it doesn't. It doesn't kill the hair follicle. So we need to go deeper and kill the hair follicles. So we have that on the face. We have the neck. We have under the arms. Under the arms is a very common place, especially in ladies who need hair removal. For men, we have chest hair, back hair. For ladies, again, a lot of them will have what's called a bikini line, or a full bikini called a Brazilian,
right,
where the whole pelvic area, pubic area and pelvic area is treated.
So you can do the whole thing.
You can do the whole thing. Legs, arms, so on and so forth.
Okay. Well, I guess we'll kind of wrap up then, because I think we covered most of it. Is there anything else you wanted to bring up?
No, I think we've covered it all. The main thing is to come in and sit down and speak with the provider. In my office, I'm the only one who treats. So coming to my office, you have the advantage in that you'll be consulting and being treated by a physician versus a nurse or other technician. But that's the main thing. Whoever's going to do your treatment, you need a full consultation, sit down and talk, just like we've been doing. Like, this is basically a consultation I've given you about hair removal and about laser tattoo removal.
We've taken a lot of the work out of your business there, huh? You could just kind of like, I'm going to leave you in the room for this. I'll be back in 45 minutes.
Exactly.
Are there any promotions you have coming up that people can look for?
Yes, we always have promotions, usually on our website. Our website, if you don't mind my saying.
We'll bring it up later, too.
Removers.ink. That's .ink. And usually we're running either some free sessions that we're offering you, or we're offering you 2-for-1s or 3-for-1s. So on and so forth. We do have a presence on Groupon, but we would like for patients to actually, before they purchase a Groupon, to come in and do a consultation and first, so they would know exactly what they're purchasing before they do, because many times they'll purchase a specific area and they will not have measured it or not measured it correctly, and then when they get in the office, they're shocked because they thought that they had, a certain number of square inches, and that was not the case.
And that must be a mess to try to fix a Groupon.
So we love Groupon. because it gets our name out there,
Oh, no,
but we
yeah.
want people to actually come in and do a consultation before
Yeah.
they purchase one.
Well, again, this is Dr. Aldridge.
Yes.
Thanks for coming by the show.
Aldridge.
Sean Aldridge. So we mentioned, we'll bring it to you one more time about where they can find you, Removers.ink. You're also on Instagram at Removers.ink.
At Removers.ink. I think, is it?
I think that's what I have
Is it
here,
Removers.ink?
Uh-huh.
Our phone number is 818-386-1947. Call, leave a message. We're in the office from Tuesday through Saturdays, and from 9 to 6. And we'll be happy to see anyone who wants to come in for a free consultation. Let me not leave that out. All the consultations are free, whether it's hair removal, laser, tattoo removal, and other procedures that we provide.
So when I show up after this show,
You will have your consultation. We'll just put the numbing cream on you, and then we're ready to go.
Again, this is Dr. Aldridge from Tattoo Removers in Sherman Oaks. For more information, we'll have all this information as well on kpcradio.com. I want to thank you all for listening. I'm Anthony Sanchez.